say something, you say no.
All right, welcome back. And now let's take a look at how much researchers have been done in Nigeria to help fight the coronavirus that we are facing, not only in Nigeria, but world over. We have joining us Dr. Raheem Toyosi. Dr. Toyosi is a medical laboratory scientist, as well as a research scientist of the molecular diagnostic from the NIMR, that's the Nigerian Medical Research. Welcome to the program. Great to have you join us.
And thank you.
Now, let's begin from the fact that in response to the growing COVID-19 pandemic we are facing here, we've seen shortages of laboratory-based molecular testing capacity and reagents. We've also seen multiple diagnostic test manufacturers developing and selling rapid and easy-to-use devices. Now, the question is this a way out of, or is this a way of contributing to stopping the spread of coronavirus right here in Nigeria? And how reassuring are these equipment?
Well, thank you very much for inviting me to be part of this discussion. Yes, there are, COVID-19 is now a serious issue that is staring all of us on our hands. And it's a call for all of us to put our best on the table in order to arrest this pandemic. Since the advent of this pandemic, late 2019, there has been several attempts by scientists to produce diagnostics and identify the causative organism of this serious pandemic. As at now, there are several diagnostic kits, close to about 200. And for now, only very few are acceptable for use for diagnosis of COVID-19. So there are several attempts at producing diagnostics. And for now, only very few are recommended. And the ones that are recommended are the ones that we directly detect the pathogen, which is based on the reverse transcription polymerase chain reaction. So there are several attempts by scientists, and people are really working to ensure that there is proper and prompt diagnosis of COVID-19. And there are also, after knowing whoever that is having it, there are also attempts at having interventions that will rapidly put an end to this scourge. So there are several attempts nationally and globally at making sure that things are done in order to quickly bring to an end this COVID-19 pandemic.
Yes, Dr. Raheem Toyosi, the last time we had the DG of NIMR come on the show, he talked about what NIMR is doing in terms of testing capacity. Can you bring us up to speed with what it is that NIMR is doing in terms of testing COVID-19?
Well, I'm happy that you said you invited our Director General, Professor Babatunde Lawal Salako, to your studio. And I'm sure he must have aptly presented what NIMR is doing and what NIMR has done in our own way, that is in the little way of Nigerian Institute of Medical Research, in making sure that we act promptly and responsibly in line with the mandates of NIMR. So he must have presented a detailed attempt of what NIMR has done and what we are doing. But to add to what he must have said, if you see the nature of this disease, it's more or less strange to scientists, even globally. So everybody is trying to do their best to bring their best scientific knowledge and approaches to how best to contain this. If you look at what NIMR has done, the first of it is that the attempt to fumigate the entire area within the perimeter of NIMA to ensure that this pandemic is not allowed to spread within and outside our jurisdiction. Apart from that, we also have the management directed the crop of scientists in NIMA to put their best together on various aspects of research. And for now, we have several proposals, close to 15, 20 proposals that have been developed in an attempt to make sure that this pandemic is quickly brought to an end. And long-term interventions are also put in place scientifically. And NIMA is doing wonderfully well on this. But more than that, more than those ones that I have listed, is a kind of innovative approach to case detection, which NIMA has brought to the table, which is very innovative and I think is perhaps the first of it in the whole of Black Africa. And that is the kind of drive-through testing strategy. What that implies is that there was an online software that whoever wants to be screened for COVID-19 could access on NIMA website. And that software is open to the public. Whoever that has the willingness to come and do the test or testing for COVID-19 could access that document online. Once the necessary information is completed, the person is free to drive through a dedicated point in NIMA and have him or herself screened. And it's more or less strictly confidential. In other words, once that document is completed online, the person is free to drive through the dedicated point in NIMA, have the samples collected, and after the completion of the whole process, the person will have the results released to him after the proper validation and other procedures have been completed. So if it is somebody that we require further intervention, NIMA has a strategy of linking up with Nigerian Center for Disease Control and the Lagos State government. And before you know it, the necessary intervention will be put in place for that individual. But in terms of
believe
research,
that this is one of the proposals NIMA has to maybe give to the government so as to hasten or quicken the way we test people in Nigeria. But how realistic do you think this drive-through is? Since you say people will drive through after filling the forms or information online, they need to drive through. How many offices does NIMA have, or how does NIMA intend to go about this drive-through test?
It is not how we intend to do it. We have started doing it. In fact, if you, by our own performance assessment, NIMA has done wonderfully well since the introduction of that drive-through process. It's the first in the whole of Africa, if we have to be modest. And we have feedback which our Director General has communicated to the management of the Institute that it has received a kind of wonderful accolade, even from international bodies outside Nigeria, that that's quite innovative and really a way of reaching out to the public. So it is very, very realistic, and people have been benefiting from that strategy. So I think it's a kind of strategy that NIMA should be highly commended for, because people can easily drive in after filling. In fact, several people have called willing to, showing their willingness to be screened, and they have been directed to fill the document online. And once that document is produced, a kind of a time where the schedule will be given to the person, come so time, so date, and once the person is around, the person will be promptly attended to. So it's been very realistic, to be frank, and if we have such several strategies across a country, I think it will be a way of scaling up case detection of this COVID-19 pandemic. So NIMA, in my own opinion, deserve a kind of commendation for being that innovative.
To this level of success recorded so far, do you have figures to it?
For now, I will not be in a position to give you definite figures because there are procedures and processes in releasing figures. But I can authoritatively tell you and tell Nigerians that it's been very wonderful. Nigerians and those who are willing to access the service have really been benefiting from that service that NIMA has provided. And all we need to do is to continue to encourage and provide the enabling environment such that Nigerians will benefit more from that strategy.
Now, according to the NCDC, Nigeria currently has the capacity to carry out 1,500 COVID tests daily in 13 molecular diagnostic labs. With, now, you know that every other day we're seeing the numbers increase. On Tuesday, we saw 117. Yesterday, we saw 91 cases. Now, do you think that we need to do more in terms of expanding our laboratory tests or testing?
Frankly speaking, we need to do more. Nigeria is doing very well, but we need to scale up our attempt at screening the masses. Nigeria is a big country with a population of about more than 200 million. And if you look at our rural communities, there is need for us to scale up case detection, even in those rural communities. Because I had the opportunity of going out yesterday, I saw the number of people that are even traveling using trailers and other big buses that are ordinarily not used for transporting human beings. And you see people moving in and out. Even the security people are really trying their best, but people are still using one strategy or the other to move out of various places. So that is why we have this rising data that you rightly reported, because if you look at it, we are now experiencing what we call community transmission. And it is because more and more people are moving here and there. So Nigeria, because of our size, I am of the opinion that there is nothing wrong if every state has a testing center. And for me, manpower should not be a problem because Nigeria is well endowed with various professionals that can adequately do this in terms of the medical laboratory scientists, in terms of other health professionals, researchers that can be empowered to do this. So if every state has a testing center, it will not be out of place. And there is hardly any state now that you will not see scientists. Even when you look at 774 local governments in the country, you will see scientists and health professionals that can be mobilized, trained, short-term training, because there is need for training. It's not training on how to read and have the scientific principle behind it, but training on how to use the guideline so as to ensure that people are not infected, by them, they themselves are not infected in the process of carrying out this national assignment. So for me, Nigeria is trying 13, 14 testing centers, fine, but we still need to scale up. There is nothing wrong in each state of the federation having their own well-equipped, well-manned testing center.
You know, Dr. Toyosi, it's pretty pathetic that we are still grappling with increasing our testing figures as we speak, when couple of other nations are beginning to look at ways of creating a vaccine for this pandemic. The only cheering news that anybody would want to listen to right now is that a vaccine has been found. As we speak, the UK will begin the first human vaccine testing today. From your own side, as the medical researcher that you all are, what exactly is Nigeria putting together in terms of finding a vaccine for COVID-19?
Thank you very, very much. Again, I will still use NIMA as a case in point. What the scientists should do in an attempt to produce vaccine against this disease is to first of all know the character or the characteristics of this organism. And we can only do that if you do what we call genomic sequencing. And that NIMA has done in partnership with some other scientists. And for the very first time in this country, NIMA, with the team, has really sequenced the SARS-CoV-2 virus that is a causative agent of this COVID-19. It is when you do sequencing that you will know the details of the genomic characteristics of the virus. And then you will see the epitopes. There is something we call epitope. That is the part of the organism that can elicit immune response. And when that part of organism that can elicit immune response has been identified, that is when you now one can now begin to think of vaccine development against that immunogenic target. That is the target that can elicit immune response, that can elicit antibody production, or what we call cellular immunity in whoever that is giving that vaccine. But the process of developing vaccine and getting the vaccine ready is not what you can get overnight. It's a long-time scientific work, which will now lead to the expected desire, which is the vaccine production. So vaccine cannot be produced overnight, especially that this organism is a novel organism, and we need to study the characteristics properly in terms of ability to confer immunity on whoever that is given that candidate vaccine. So as at now, everybody, scientists, NIMA and the other team, they are working seriously on how to identify the immunogenic component of this virus before vaccine or the candidate vaccine could be attempted. And even at that, you still have to do what we call clinical trials before eventually it could be recommended for use. So it takes a while. It's not something you do within 2, 3, 6 months and you say you have come up with a vaccine. It has to undergo proper scientific processes before anything is released into the public domain.
Right now, there is a belief that the test is painful. We've seen from pictures how some of these tests are done, maybe a swab in your nostrils or at your tonsils, where something medical is put inside to get a specimen of the individual. Now, I need you to debunk or maybe correct the myth or the fears of people who might seem not to go for this testing because they think it's a painful procedure.
Certainly, this test is not painful. It's people, those who have done it, and those who have seen people do it, will certainly know that it's not painful. If you watch the procedure, the only thing may be a kind of slight irritation or slight discomfort when the swab stick or when the swab is inserted into the through the nostrils. And once that is done and it is properly collected, it's not painful at all. Even if it is oropharyngeal swab, all you need to do is to aseptically put the swab, use the swab to collect the secretion from the appropriate part of the oropharynx, and then the thing is brought out. It's not painful at all. You cannot compare that process with what we call phlebotomy, in which case you insert the needle into the vein and collect the blood. The use of nasopharyngeal swab or oropharyngeal swab is not painful at all. The only thing is just that little discomfort of having the swab introduced, which is normal. Even when you use a cotton bud to clean your hair, you will see some people still feel some little irritation, but it's not as if the testing, the sampling procedure is not difficult at all. It's not painful. I can assure Nigerians that it's not painful at all. And those who have done it can attest to that it's not painful. Sampling is not painful at all.
All right, Dr. Raheem Toyosi, we appreciate your time with us. Thank you for the insights you've brought to the show. We just hope, I just wish NIMA the very best in all its endeavors. We really hope that sooner than as expected, we'll be getting some form of vaccine coming from NIMR. We shouldn't wait for the UK or for Israel or for the US. We have qualified scientists in Nigeria to bring a vaccine for COVID-19. We wish you all the very best. Thank you for your time, sir.
Thank you very, very much for inviting me and for allowing me to be part of this discussion. Thank you. I really appreciate it.
Thank you. All right, we'll take a break this time and we'll come back. We'll have more discussions for you. Don't go away.